Hello, my name is Sonam Gurung, and I'm brother of Tilak Gurung, who is the patient. I'm from Bhutan. He started his sign of sickness from last year, 2024, somewhere around December and November and December. After that, the first sign was he had a very low hemoglobin. And after that, he started having a diarrhea and all. And he became weak day by day. After it was third time of his, he did a blood transfusion. The doctor made a point to check his creatinine. And the creatinine level was around 7 that time at the beginning. Then after that, the doctor told my brother that it should be something must be done about his creatinine level. If not, kidney will be damaged. My father took him to Siliguri for the detailed check because being a private, they down there it took only 3 days for the checkup, and they clarified that the kidney is damaged and there's nothing they can do. And my brother and mother came back from there, and they started the dialysis from there. Dialysis would not suffice us. It would not be like good in long term. So we decided that maybe we could try for the kidney transplant. And we started following up with the doctor regarding his treatment for the kidney transplant. After processing almost, I think, third test, he had a stroke, a major stroke. And that time it was really hard for every one of us, especially my mom and dad. They couldn't bear him having the stroke, which was major one. And the doctor over there said that we should be prepared for the worst over there that time. Yeah, it was really hard for us, for the whole family during that time. It's not we chose the hospital. The doctor over there recommended RNT spray. His journey to the RNT was helped by a doctor over there. After getting all the tests done, everything was okay to go. Around it was June or July. We came down here. He was he had a very weak body because of a rare disease, Factor VII deficiency. We were waiting for his operation to be okay, like his operation will be done this and that date, but no date came. During that, the DS Roy and Dr. Cecil, they were really worried about his genetic disease, Factor VII deficiency, which is really rare. I think this is the third operation done in the world because of his disease. The interesting part of the story of the surgery is it was right before the Diwali, and the surgery went successful. My mom and me were really worried during the surgery, but after surgery, which they said like it was successful, and my mom was the one who was really happy. I was happy, I was not, but my mom was the most happiest person who said like, we had a delay in the operation because my father is also suspected of having the same disease as my brother, Factor VII deficiency. So there was high chances of bleeding during the surgery. It was really tough decision on my father because even like doctor, we did not know that he might be having that disease. Only after doctor said that he might also be the disease. So after that, my father was really the bravest of all. That's no worries, I will be the one to give him. So he's doing quite better from how he is, and he's doing his physiotherapy currently, and he's doing much better. And this is all thanks to especially I would like to thank our government, Bhutan, who is funding our treatment from everything over here. And second of RNT, who is there. Just like how we have brothers in another place, RNT has become our second home.
This is the story of a remarkable boy from Bhutan, Tilak Gurung, some 27, 28-year-old, and his remarkable family and family support. This is also a story of us, the doctors, nurses, and other staffs of RN Tagore Hospital. The story is that if we plan, if we discuss, if we cooperate with each other, we can do impossibles. Tilak Gurung came to us with a very, very rare disease, which happens 1 in 5 lakhs, 50 lakhs in world. And that is a blood factor disorder, and that results in bleeding whenever there is a little injury or little trauma. She has been suffering from that from the childhood and has been on replacement therapy, which is very expensive, supported by the government of Bhutan. He is from Bhutan. His brother also had similar problem, but he didn't have the kidney failure. Tilak unfortunately had kidney failure. And his disease is so serious. He had earlier stroke, cerebrovascular stroke. He had bleeding in the joints. And he didn't have a fistula done, which we require for a dialysis, because if we prick the fistula, he will have bleeding. They had father and mother as donor, and father came forward to donate. Then we tested, we found Tilak and his brother had, which we call homozygotic disease. That means they have got genes both from father and mother. Now, Tilak had Factor VII deficiency, which is very uncommon, as I said, and his Factor VII level was 0 when we tested for it. His father and mother both were carriers, and unfortunately the carrier gene had gone to both the sons, and both were sufferers. Now Tilak came for a transplant because he cannot continue on dialysis. Young boy cannot continue on dialysis indefinitely for long period. And the father was ready to donate. But we have a dilemma. Once, the donor we should not be doing any harm to the donor, and father being a carrier may have a chance of bleeding while doing the surgery. So this has never been done in the world, that father as a donor, kidney donor, or father or mother, any kidney donor who has a Factor VII carrier state. Now we need to give 100% safety to the father. So we had long discussion, multiple discussions for 4 to 5 months. And then when they were adamant, or they wanted to really go ahead with the transplant, we accepted father as donor, and son obviously had the disease. And it was a tough decision because transplant can have bleeding and we may lose the patient. In the whole world, there are only 2 case reports, one from Middle East and one from Italy, doing such kind of transplantation. So we formulated a team. We found a team, the nephrologist, the surgeons, the anesthetist, and the hematologist. They had a great role here, and the pathologist. And we monitored, we decided, we had a number of meetings. We decided how to go about it. Completely we planned, and the plan was chalked out. And step by step, we went ahead and did the transplant in mid-September. And every 2 hours we did the blood test, and we gave large volume of the Factor VII injection, which is very expensive actually, and it was all supported by the government of Bhutan, as I said earlier. He had, after 7-8 days, a cerebrovascular accident or weakness in the right upper limb and lower limb, but which improved with the treatment. We roped in the neurologist to treat it, and finally, after 3 months, they were discharged in time. After 10-15 days of the transplantation, they stayed here as is the rule for very close follow-up. And just few days back, they have gone back very, very happily. The whole family was happy to Bhutan. And as far as I know, he is doing very well. Thank you.